Thanks, Michelle, and hoping you can hear me. I'm really excited to be doing this, both as part of this collaboration between Reporting on Health and AHCJ, and just to give folks AHCJ's website, which will have the same information about this webinar as Reporting on Health. It's healthjournalism.org. This information we're going to discuss today is not just relevant if you are a reporter in California. Health data and information about hospitals and their finances and how hospitals use services are collected in almost every state and are available publicly if you know how to ask for it. And so what I'm hoping this webinar will show you is some of the things you can look for in this data, how it's relevant to writing stories that you are interested in, but also to keep your community and the neighborhoods you cover in the loop about their hospitals and whether they're delivering the services that your communities have come to expect from them. So while OSHPD is in and of itself primarily helpful for California journalists, these type of resources are very helpful in other states. And I hope those of you who are not from California will take away good questions to ask. As I looked at the answers that you guys wrote about your experience with Excel, it looks like most of you have the ability to navigate a spreadsheet and sort data, and that will come in very useful here. A number of you have a more moderate or higher level of Excel knowledge. So if I'm going too fast on the Excel part of it, please feel free to raise your hand with Michelle or ask a question even during this introductory period, and Michelle can ask me to slow down or to repeat something. I'd hate to lose you during the early part of my presentation. The other point I just want to make is that the specific questions you asked, some of them we'll cover today. Some of them aren't directly relevant to the data that we're going to be discussing. And so while they may be good stories and good ideas, we won't be covering them during today's webinar. So I wanted to just take a minute to give you a little bit of a tour of the OSHPD website so you understand what this organization is and how it's useful to your coverage of healthcare, particularly in California. So OSHPD gathers information not just about hospitals, but also about long-term care facilities, clinics, and home health care and hospice in the state of California. Organizations and agencies and facilities are required to submit information. As you can see at the top of your, as I just moved my cursor, each different provider of care has a different tab here, and you could click on one to get to. Whoops, you can click on one to get to those agencies. The information you can expect to find is both financial data, which we won't be talking about today, and that's the dollars and cents of these healthcare institutions, how much money they bring in, how much money they spend, how much money they spend on charity care, the average cost of taking care of patients over the course of a day, and that sort of thing. We will talk about today about utilization data, and that's how much services are used in a particular hospital. And I'll click on this, and you can see the various different data types here. As I mentioned initially, the financial data. Today we'll be talking about the utilization data. There's also quality reports that are released by OSHPD, and they have quality information available. We won't be talking about those, but they're worth perusing. They release information about seismic preparedness at hospitals, and you can see whether your hospital is equipped to handle an earthquake or whether patients are going to be put in harm's way. And there's been quite a bit of coverage on this, but in light of the vast damage that's been done in earthquakes in the state of California, it's an important topic, particularly if hospitals in your community have not taken the necessary steps to upgrade their buildings. And finally, they also offer interactive maps on the website that will let you see different health statistics and characteristics within the state of California graphically displayed. I would be remiss if I didn't also note that there's an extremely helpful press office that OSHPD has. At least it's been helpful to me, and I hope it's helpful to you. Dan Burns at OSHPD, and if you go to the tip sheet I put together, it's at the bottom of that tip sheet. It's his contact information, and I'm sorry, David Burns, not Dan Burns. And David has been helpful to me, and I hope he will be helpful to you as well if you have questions that I can't answer. Before we dive into the data, I thought it would be helpful to take a look at how OSHPD's information has helped shape reporter stories, because there are many, many examples of great reporting which has originated with a kernel of data from OSHPD. The first example I want to show you is the story that Christina Jewett took the lead on for California Watch, which is part of their ongoing series called Decoding Prime, which looks at Prime Healthcare, which is a major for-profit operator of hospitals in the state of California, and one that's been pretty controversial. Using the AHCJ data, they were able to determine here, I'm going to highlight this paragraph here, that Prime stands out from the perspective of patients who are admitted to Prime hospitals from the emergency room. And Tenet Healthcare, for example, admitted 39% of its emergency room patients at its hospitals, compared with 63% at Prime hospitals. Why this is important is whether or not hospitals are using sort of the emergency room as more of a cash cow than others, and whether patients are being properly admitted to their emergency room. And AHCJ data, the utilization data that we'll be talking about today, you're able to take a look and see whether or not patients are being admitted to the emergency room, at what percentage of ER patients are they being admitted, and how does that compare to the state as a whole or other peer institutions. So this is an example. I'd encourage you to read it. There are links in the different tip sheets that we have on both websites that will take you to this article, and I hope you'll take a look at that. Another group of stories is one that Jordan Rao did for Kaiser Health News and Sarah Varney did for KQED and NPR, which looked at differences in costs between different regions of the state of California. And you're able to look at this and use this by using AHCJ data. This is the financial data, which that didn't work. But if you read through the article, it talks about how the hospitals in Northern California are significantly more expensive than the hospitals in Southern California. And the data, if you click on, whoops, that's not working either. If you click on, if you read the stories, the data is coming from the AHCJ data primarily, and that's helped them to put this information in the proper context. So those, again, links are on the site. Finally, the last example I wanted to show was a recent example that Emily Baser did for CHCF, Center for Health Reporting, and this was based on a study that looked at the use of angioplasties within California and whether or not certain communities had higher rates than other communities. And today I'll show you within the AHCJ utilization data how you can actually look within that to see at each hospital how many angioplasties they perform and how many stents they implant, and the results are a little bit surprising. The other thing I wanted to show you is just the tip sheet. This should be linked on both sites, and you can, after this session, follow along with these steps in order to get to the data we'll be talking about today. So the first thing I want to show you is just how you would get to the data, and you should have gotten a link after you signed up for this webinar in which you can, with links to the data itself. And so I want to show you where you would get that. Your link took you to this page, and there's two different options that you have. The first is for the full database, and the second is for pivot profiles. And I've asked you to download both of those. Probably best to follow along with what I'm doing and download the files subsequently, but you'll want both of those as well as this link here, which is the report form and instructions. And before we look at the data itself, assuming that you've downloaded those, just to give you an idea of what it will look like when you actually do that, when you click the pivot profiles, you will see a box like this with the option of saving it or opening it, and then you would need to unzip the file, which would look like this. And then you would open the Excel spreadsheet, which I've done, and we'll look at that in a minute, but that's just how you would download this onto your computer. So then you actually have the data file on your computer. But before sort of digging into the data, I actually think it's kind of important to understand, well, what is in the data, right? Because you can blindly look at it, but if you don't understand what it's collecting, it's really difficult for you to get a perspective for what it is that you're looking at. So this is a copy of the form that hospitals had to fill out in 2009, submitting information on their use of services. And it takes you through information about the facility, about the parent corporation, and then various information about the way the hospital's organized, what services they provide, the number of licensed beds, the number of discharges, the number of patient days, for a variety of services. So you see here the newborn nursery, inpatient beds, various categories of inpatient beds. You see information about their emergency room and the different types of emergency room services that are available there. You see information about the number of hours that the hospital is on ambulance diversion. And what ambulance diversion means is when a hospital has said that they are so full that they can't take any more ambulances, and ambulances are directed to the next facility, the next closest facility. Information about operating rooms and information about live births at the facility, information about cardiac catheterizations. So there's a whole lot of information here that you can see, and I'm going to make the text a bit bigger so that you can take a look at it. But the first thing, again, that I would advise you doing before you actually dig into that data is to take a look at this. Take a look at this form, understand what needs to be provided, and that will help you understand the column headings when we actually get to the data, and it will help you understand just what it is that hospitals have to gather. Let's go to take a look at the data. So I'm going to show you both different data sets. The first is the complete data set, which is, let me go back to the website and just show you what I'm clicking on here. That's this data set, the final database. And you notice that there's a 2010 preliminary database. I've decided not to deal with the preliminary data, although you certainly can, but to pull down the 2009 final database. So clicking this link will bring you this particular spreadsheet. And you'll see here that on the very first screen, when you open the spreadsheet, there's tips on how to deal with the spreadsheet. And then there's tabs here at the bottom for sections 1 to 4 and sections 5 to 6. And if you hadn't looked at that report, you wouldn't know what this is talking about. But going back to the report, you can see that there are sections on this report and that their corresponding field headings relate to those sections. So if you go back to the spreadsheet, you'll see here, for instance, the facility name relates to section 1, question 1.1, if that makes sense to you. And this relates to section 5, 1.1. So right now I'm not having you do any sort of detailed analysis, but rather just getting a lay of the land for what's in these different databases. The one we're going to be dealing with primarily, which is a little bit easier to deal with, is the second one. And this is the one you would locate through the pivot tables, which is pivot profiles. And by clicking on that link and saving it, you will get a screen like this that shows up. And this is the glossary tab on that page. But you'll primarily be dealing with this page, which is the pivot selection page. And what this allows you to do is pick the different hospitals that you want to take a look at. And so let's just start it off for the purposes of just taking a look at what's provided by picking a hospital. And I'm going to pick Cedars-Sinai Hospital, which you would click here and click OK. And so you've clicked Cedars-Sinai, and that's the only change you've made to this. I actually should have stopped myself because I've already done this, but you haven't. Before you've dealt with a data set, I always like to make a copy before I've done anything with it. And I would advise you to do the exact same thing. And so even before selecting Cedars-Sinai, I would suggest you make a clean copy of this and that you work off of your copy and not the original. The reason for this is, as I was working with this data over the weekend, I made a mistake with something and it reset the data, and then I had to go back and re-download the entire file. So it's always good to have a clean file. It helps you check yourself later on, make sure you arrive at the same conclusions, that you didn't do anything that tripped yourself up. So saving a copy is critically important before you begin work. So after I've saved it, I'm selecting Cedars-Sinai. And at the bottom of your screen, you'll see Profile Summary page. By clicking on the Profile Summary page, you will see all of those different data fields that were in that questionnaire. They're populated for Cedars-Sinai. So you see at the top we're dealing with Cedars-Sinai Medical Center, and you see that it's in Los Angeles County. It tells you which congressional district it's in, which state Senate district it's in, which state assembly district it's in. It gives you information about the number of licensed beds it has. It tells you what type of ownership it has. And these are all relevant because, as we'll work on later on, you can sort in a variety of ways on this pivot selection page, which will let you compare Cedars-Sinai to its peers that are large hospitals, to its peers that are nonprofit hospitals, and to other hospitals as well. So licensed beds gives you a sense of the number of beds that the hospital is licensed to operate, which is different from the number of beds that the hospital actually operates, if that makes sense. So just because a hospital has 900 beds that it's licensed to use does not mean that patients will fill all 900 beds every day. So the licensed beds is simply an indication of the number of beds that at maximum that the State Department of Health Services and Public Health, the State Department of Public Health allows them to operate. The patient days here is an indication of the number of days that those beds were filled. And if you look here on the other side, where it says licensed bed days, this is if every bed was filled every day, the number of bed days they would have. So you can see here that when you divide the number of patient days by the number of licensed bed days, that Cedars-Sinai has a licensed bed occupancy rate of 79.27% in 2009. Now, what you don't know in looking at this is that high, is that low, and we'll have some. I'll show you how to get some comparisons after we've gone through the sheet. It tells you the average length of stay in the various units, and it tells you the number of discharges. This is all for Cedars-Sinai. Scrolling down a bit, you're able to see information here about births, about the number of births at the hospital, 6,718, and the number that were C-section, the number that were vaginal births, and the number that were in an alternate birthing center. It does the calculations for you. And again, I'll show you how to compare that to other facilities. The other thing you can see here is live births by weight, and these would be low birth weight and very low birth weight infants, which helps you understand sort of the level of the level of services that this OB unit is providing, and whether it's caring for very low birth weight children, which could increase the amount of time in the neonatal intensive care unit. Before I go on, I just wanted to remind you, as Michelle said at the beginning, and as we said in, I think, the email, that you can feel free to tweet and share what you're learning using the hashtag OSHPD, OSHPD, during this call and after the call. So I hope you'll think about doing that. Going down, you can see emergency medical services, and this is a sense for you of the number of EMS visits at the hospital, and it will also tell you the number of hours and the percentage of the time that this hospital was on diversion. And remember, diversion is when you're close to ambulances. One unique thing about Los Angeles County is that hospitals are often on diversion, and so diversion loses its meaning, because if every hospital is turning away ambulances, basically it opens up all the hospitals to ambulances, because the ambulances have to have somewhere to go. So typically if one hospital is overcome, they would go on diversion, but if every hospital is overcome, they basically all have to take any ambulances that show up under federal law, which requires them to screen and stabilize all the patients that show up in their emergency room. You can also see here the breakdown of the EMS visits by acuity, that's by severity, and how that breaks down as far as the types of situations they were dealing with in the emergency room. As I mentioned, the issue of the emergency room visits that result in admission and what the percentage was at Cedars-Sinai was 27%. Remember that for Prime Healthcare, what Christina reported was that it was in the 60s, so it was considerably larger. And then there's a bit of information here, which is the visits where a patient left without being seen, which could be an indication that the emergency room is not well functioning. If a lot of patients are leaving before they're being seen by a doctor in the emergency room, it's a sign that things they're either overcrowded or they don't have a very good way of moving patients through the emergency room, or very long delays. Finally, at the bottom, there's a chunk of information about the services that are provided, surgical services and cardiac services, the operating room minutes, the average time in each surgery, and information about pacemakers and stents, and we'll take a little bit of a look at that going forward. Finally, at the top, you'll notice this thing that says security warning. Macros have been disabled. In order to really get the full use of this, you will want to enable your macros. And so you would just hit the options, enable this content, OK. And by doing that, for instance, here, you could click Retrieve Facility Names, and it will tell you that you're looking at Cedars-Sinai Medical Center. This is important because as you go to subsequent pages and you're looking at groups of hospitals, you may want to know which hospitals you're looking at that are grouped together, and hitting Retrieve Facility Names will get that list for you. So let's write down on our pads, if we can, a couple things that we wanted to see how Cedars-Sinai compares to other facilities. Just looking at the top, I'm interested in knowing about the licensed bed occupancy rate at other facilities. And so I'm going to write that down. And Cedars-Sinai is 79.27%. I'm interested in the C-section rate, and Cedars-Sinai is 39.19%. And finally, I'm interested in the percentage of EMS visits that resulted in an admission. And for Cedars-Sinai, as I mentioned, that's 27.75%. So how do you now compare this information? So we've seen what Cedars-Sinai is. How do we go about looking for other hospitals? We would go back to the pivot selection page, and we would first undo what we selected. So we would undo Cedars-Sinai and go back to all. So now this is exactly the way that we found the page when we started. And I'm interested in seeing, compared to other large hospitals, what is Cedars-Sinai, how do they compare? So in this case, I want to adjust bed size range. And I'm interested in hospitals with 500 or more beds, and I'm hitting OK. So the only thing I've done here is that's the only sort of subset I do. Now, I could go and refine this in many different ways. I could go and say I'm interested in only nonprofit hospitals that have more than 500 beds. Or I can say I'm interested in only hospitals in Los Angeles County that are nonprofit that have more than 500 beds. I don't want to do that, so I'm going to go back to all so that I don't tamper with the experiment I'm trying to do. One note about type of control, for those who aren't familiar, hospitals generally are nonprofit or for-profit. So here is the nonprofit, and investor is for-profit. They can also be owned by cities and counties, like Los Angeles County has a number of hospitals, the University of California. The state hospitals typically refer to psychiatric hospitals. So I'm going to say all hospitals. After we've selected the data we want, we'll go back to the profile summary page, and you'll notice on here that it's now at the very top saying that we're looking at 18 hospitals. So there are 18 hospitals in the state of California that have more than 500 licensed beds. And by going to the bottom, sorry if I'm giving you whiplash by scrolling so much, you can see what the list of those hospitals are. So these are the hospitals that in 2009 had more than 500 licensed beds. And again, that doesn't mean that they were 500 operating beds, just more than 500 licensed beds. So let's see how Cedars-Sinai compares to the broader group of large hospitals on the measures we looked at.